I'm Janelle Ocampo, and I've got some tips to help you get more proficient with ultrasound scanning. I know that some of you have taken some classes and have gone home and feel a little intimidated with practice, so I'm going to give you a few helpful tips to get you more acquainted with your transducer and ultrasound scanning. First of all, the left side of your screen is the right side of the patient. When we hold this transducer, this line here is the line that we are going to tip to the patient's right. And so what we would be seeing on the right side of the screen should be on this side of the transducer. And I know that's the opposite for you, but if you practice this with your hand, you'll see and understand. And what can be helpful is when you have the transducer on the patient's face, that you lift up the side that you think is the correct side so you understand the orientation on your screen. Now when scanning and you're looking at the screen, understand that the upper part of the screen is the patient's skin, and the deepest part of the screen is the deepest area that the ultrasound is penetrating. Oftentimes you'll find it's bone. When we hold the transducer, we hold it with our fingers very close to the tip of the transducer, and this helps us control it. As we have this transducer anchored, we're controlling the movements that we're making on the patient's skin. Now make sure you've used plenty of gel so you have great skin contact. All right, so now that we have plenty of ultrasound gel on our transducer, I'm going to go ahead and orient myself to my masseter. So when imaging, we are focusing the transducer in different planes, and I'm going to go ahead and increase the gain here so I can identify or distinguish between cystic versus solid. So the first thing that I've done is I've sat my transducer down in the longitudinal plane. And the longitudinal plane isn't always directly up and down. It's dependent on how that structure sits in the patient's skin. So right now I'm looking at a masseter. And if I want to see the masseter in transverse, I'll go ahead and turn this around. I've turned it to my right. And if I want to confirm that I did turn it the right direction and what I'm looking at on the left side of my screen is to the patient's right, I can go ahead and lift that side of the screen and just confirm I am oriented to my screen correctly and I have my transducer sitting right. So as I scan through a structure, what I'm getting are many slices of images, and I'm putting together that whole picture in my head of what I'm looking at. Now, to be able to get a good picture, there's a couple ways that we maneuver the transducer. One of them is by sliding. Now, if I found the transducer, but it's sitting to the corner of my screen, and this happens a lot when I'm in training, I say to my students, go ahead and center that structure. They're like, well, I just found it. I'm really excited I found it, but I'm not sure if I can center it. What you want to do is slide it towards the structure. So your structure is more centered in the screen and you're getting more information that way. It's like taking a picture with a person off to the side and you wanted the picture with the person in the middle. So the same thing, we're gonna slide the transducer so we get the image right in the center of the screen. So now that we've centered our structure of interest, the next thing we'll want to do is tilt the transducer to get the structure at the dimension that we want, which is typically the largest dimension. Now I can tilt the transducer cranially to get more of the superior portion, and I can tilt the transducer caudally to get the more inferior portion. I can tilt anteriorly to get a more anterior portion. And this is also called the ventral plane. And I can tilt posteriorly to get the dorsal plane, or the more posterior portion of the structure that I'm looking at. Now with sliding and tilting, this is how we can get the structure in its largest dimension. Also, it helps us to scan through the structure so we know all the information of that structure. And we're not just getting a little piece of that information, which could potentially be a tip of the iceberg. We want to be able to scan through the structure in both the sagittal or longitudinal plane and the transverse plane. And it's called surveying your structure. I'll give you another example of how to scan a structure, but with a vessel as a focus. And what I've grabbed now is my facial vein. So as I'm looking at the facial vein, I have it in transverse. Looking for facial veins or looking for veins in transverse is much easier than looking for it in the longitudinal plane because you're more likely to grasp it. And then you can turn longitudinal to elongate it. Now, what I'm doing is I'm rocking this transducer and I'm tilting it, and I'm also sliding a little bit to find its largest dimension. So I've slid and tilted my transducer until I found my structure at its largest dimension. And so here I am. I don't even necessarily need to put color on it. It's nice and big and beautiful there. If I want to, I can go ahead and do that as well. And there we go. Now, once you have how to manipulate your transducer, you're ready to scan. If you like this information, please like and subscribe for more. And please leave a comment below on what else you'd like to see.